Hello, good afternoon, good morning, good evening. I'm Kathy Pike, President and CEO at One Mind at Work, and I'm delighted to welcome you all here to join us for this discussion today that is focused on learnings from our first annual report from the Mental Health at Work Index and the work we are doing at One Mind at Work. I'm looking forward to joining our Pulitzer Prize-winning journalist, Kate Woodsome, who's going to lead this discussion, and colleagues Ryan Sledge, who is HCA Healthcare's Vice President for Workforce Health and Safety, and my dear colleague David Ballard, and workplace mental health expert. Turning it over to you, Kate.
Hi, Kathy. Hi, and thank you to everybody who's joining us and virtually and on screen. So as a journalist who covers mental health and democracy, I just want to start by orienting us and naming the elephant in the room. We are living in a deeply polarized, highly anxious period of anxiety, and nobody really knows what's around the corner here or around the world. And because Americans spend a third of their life at work, no matter how good you are at compartmentalizing, that uncertainty is coursing through our organizations, our companies, schools, hospitals, right? And even without the uncertainty, maybe childhood wounds can get triggered at work by a micromanager or a lack of clarity about your job. So we're dealt a pretty hard hand right now, which is, I think the technical word for it is a bummer. It's a bummer. But here's the upside. Periods of uncertainty are opportunities for imagination. And if we're tired of feeling bad, we can imagine and act on ways to feel and be better, individually and collectively healthier. So in a capitalist culture, if not at work, then where, right? So for everybody watching, we have nearly 200 people watching. In our time together, we're going to wade through some of the problems and then opportunities for change. How can we actually start to move this needle? And so for folks watching, I'd love you to participate in this. And as questions and comments come up for you, drop them in the chat, and then I'll start to weave them in. So until some questions come in, Ryan, I want to start with you because you are in the trenches of this change work as Vice President of Workforce Health and Safety at HCA Healthcare. Set the scene for us. When you walked into this behemoth of a healthcare system at the height of the pandemic, what were you greeted with?
Well, thank you. And I think that's exactly it. We walked in at the height of a pandemic and starting a new function of workforce health and safety. In the midst of that, there were two key priorities, not just for us, but for the company. It was really take care of our business, which for us in healthcare means patient care, what we call care and improvement of human life, and then take care of our people. And that's keeping them safe physically, but then also thinking about what other support and needs that they had. So, we recognized the threat was beyond just what happened physically, but in all organizations, in all industries, there are traits of the work that often can be stressful or lead to times that are just really impactful, really burdensome on people. And so we're no exception to that in healthcare. I think we saw impacts in things like retention and the ability to recruit. And then even thinking longer term, there's been this change in the social contract between what employees expect from their employers and what we're expected to give them. And so it's been important for us to think about how we manage that, how we adapt to that so that we can continue to carry out on our mission. But certainly those issues have existed. They were just exacerbated by everything that happened with the pandemic.
Can you make this a little more real, a little more visceral for us? Like really, because if a lot of our folks watching are folks in HR who know the technical words of this, but I think it helps to hear kindred stories of like, how stressed out were people organizationally? What did you find? Like you had a huge job in front of you. And so what were you facing to fix?
Yeah, I mean, if you think about it, early on in the pandemic, especially in the healthcare environment, there was almost this sense of camaraderie that was building. We have a common enemy that we're going to address, we're going to band together, and we're going to fight against it. The longer that goes on, to use your technical word, the more of a bummer that becomes. And so that's when you start to see really lingering, lasting impacts on people. And so, You think about how stress is showing up, how burnout is showing up in the workplace, this whole great resignation, people leaving the workplace, and not just leaving the workplace, but people leaving the industries that they worked in and saying, this is just not for me anymore. We saw it there. Of course, you can think about things on the medical side. How many times are we seeing people now utilizing mental health resources, our prescriptions going up, all of those sorts of things, which is real impacts on people, which with any of our businesses that are depending on people, you see those outcomes also on the business side as well. And so things like employee engagement suffered. And one unique issue for us in healthcare has been around workplace violence. We see episodes of workplace violence on the rise as people are just dealing with more and more on their plate. So some very real ways that it's shown up in our organization.
Okay, so we have an overworked, highly stressed, burnt out population that's very mission driven. The healthcare industry is very mission driven, helping people, but then they're individually also hitting a tipping point where they can't sustain. Kathy, does this resonate with what you're seeing and hearing beyond the healthcare system?
Absolutely, Kate. We're seeing it across industries and with different stresses and pain points, but maybe what Ryan's describing with healthcare, they were among the, on the front lines, as we said, during the pandemic. Others that were on the front lines also we saw within hospitality, within retail, within safety roles, people who had to be out there were showing signs first of mental health conditions, stress, reaching breaking points that just running down the reserves that they had in terms of mental health and resilience. But then we're seeing it spread across the entire workforce because it's hitting everyone, no matter where you work today, in terms of how we show up for work, and the pressures that are on people at work today are amplified and intensified in ways that we haven't quite caught up with. Data are clear, as we look across globally and as we look across industry, that when the surveys on employee mental health and levels of stress that translate into real mental health concerns, if the stress isn't able to be managed effectively, are all at very, very high rates today.
Yeah, I know 50% of 1,500 adults surveyed in 2021 said they had left a full-time job for mental health reasons. And so that's a lot of people who are in enough discomfort to make a pretty radical change. So that's a lot of, feeling that's existing there, but then that's also a lot of money, right, David? So people are hurting, but so is business. Can you help orient us about the costs of poor well-being at work?
Yeah, thanks, Kate. In looking at this issue, I mean, it really is an employee issue and an organizational issue. And any piece of this that we're talking about, yes, of course, you want to support workers and support their mental health and emotional well-being, but doing that is also smart for business. We know that when employees are under stress, when it drags on for long periods of time, not only does it wear them down physically and mentally, it wrecks their relationships, it hurts their work performance as well. So in the workplace, that translates to withdrawal behaviors like absenteeism and turnover and presenteeism, where people are physically, they're showing up at work, but they're not at their best. So their performance, their productivity levels are down. And mental health is really big on this front because in the health and well-being space, historically, there's been a big focus on healthcare costs, right? Well, on the mental health front, those indirect costs are actually the really big ones. And there's an estimate of indirect cost just of absenteeism and presenteeism alone related to poor mental health. And this is back before the pandemic, it's like 2010. And the estimate then was that it was costing $1.7 trillion, absenteeism and presenteeism, just because of poor mental health issues. And that was expected to double by 2030. So this was pre-pandemic, and as everyone said, the mental health impact of that, essentially clinically significant rates of anxiety and depression pretty much tripled when the pandemic hit, and they still haven't returned to normal. They're still highly elevated. So you have this kind of withdrawal behaviors, the absenteeism, the turnover. You do have healthcare costs. You have accidents and injuries and people who are out on disability related to it. So there are a lot of costs there. But I'd like to emphasize the positive side of things too, because it's not just about taking care of problems when they occur because they cost a lot of money. If you're supporting workers' mental health, it's actually good for their job satisfaction, their motivation, their engagement, their performance and productivity. It's also tied to things like customer service, client satisfaction, and things like that. So I don't want to just keep it limited to fixing problems. It's just a drain on finances of an organization. By doing this, an employer can actually be a high-performing company, be an employer of choice, and be able to attract and retain the best and the brightest and be really competitive out in the market.
So I want to jump, in a moment, I want to jump into the opportunity, but I do want to slow us down a little bit to really just define mental health. And Kathy, you're the head of One Mind at Work. You're also a professor of psychology at Columbia University. Mental health is a pretty big word, right? And some people think immediately schizophrenia or bipolar disorder. Some people just think anxiety. What are we talking about when we say mental health at work?
Yeah. Thanks, Kate. I think it's a really important clarification because there is a whole continuum that we're discussing here from people who have serious and enduring mental illness along the lines of what you're describing, like schizophrenia or bipolar disorder or certain kinds of major depression, along the continuum to the more prevalent disorders of more moderate, mild depression and anxiety, and other conditions. I should put in there also eating disorders that are often frequently left out, but are serious and enduring and have major impact. We should not confuse high levels of stress with mental illness, right? High levels of stress, if it's severe enough, enduring enough, and has negative impact, can actually then translate into compromised mental health status and a mental health condition. But stress is one of those factors that we want to differentiate because we can do a lot about managing stress individually and systemically and not confuse stress as a mental health condition, although it has significant impact on mental health. And in working with organizations, we look very to think about mental health across the entire continuum, from severe and enduring to more moderate health conditions to simply not being well and sort of top of your game and flourishing. And organizations, as David said, the more organizations can address people's mental health needs and manage the symptoms of mental health conditions so that they are in a healthy mental health state, or they're going to be able to show up for themselves, their families, their workplaces, their communities.
Super, super helpful. And I want to, as we inch forward, I do want to have folks illuminate some of the symptoms in the answers that you're giving. And so I want to, but let's go back to what David previewed, is that this is a difficult period, but it's also a period of opportunity. And we can fix a problem when we know what's wrong. So David, you helped develop a way for workplaces to diagnose the problems that can treat them. Can you talk about the index that you've helped develop?
Yeah, this when you're talking about this issue of mental health in the workplace, as Kathy talked about, it's a whole continuum. So it's not just the smaller portion of employees who might have a serious or significant mental health disorder. One silver lining of the pandemic was that it, I think, rose the awareness of employers across the board that mental health it's just a human issue. It's a people issue. We all deal with this, and it exists and can shift from person to person, from day to day, and it's something we all have to contend with. And organizations have to contend with this if they want to have a sustainable workforce, if they want to have business continuity when there are disruptions, if they need to support people when our lives are turned upside down by something like the pandemic. But to be sure, this wasn't a new issue when the pandemic hit. This is something that's been around for a long, long time, and I think it forced more employers to grapple with this. But at the point, there was not a good comprehensive way for organizations to assess their efforts to support workers' mental health across the board. So we're not just talking about having a good mental health benefit or an EAP. We're talking about all the organizational efforts that can help support workers in a lot of ways. So there wasn't a comprehensive way.
Slow down one second. The EAP is the Employee Assistance Program, which many folks watching will know, but that's like an in-house therapy service that is offered. Is that right?
Yeah, that's most medium and large size organizations offer an employee assistance program where at no cost to the worker, they can go and access a limited number of counseling sessions or support sessions around issues that might be affecting them at work, and then get referrals on if they need more in-depth treatment. So
okay, and so it's not just a matter of EAP or good benefits. You have found there's a whole other set of factors at play here.
Absolutely. There's a host of things that employers can do, but there wasn't a good way to evaluate and assess whether an employer was taking steps across the board to support their workers and based on good evidence. So back in 2021, One Mind at Work and Columbia University's Mental Health and Work Design Lab and Ethisphere partnered to create this index. So we came together, reviewed the literature. So we were looking at the scientific evidence. We reviewed guidance documents from the International Organization for Standardization, the World Health Organization, the UK's health and safety standards, and a variety of other sources to look at what the good evidence was. And collectively, through this partnership, we developed the Mental Health at Work Index, which is a self-assessment that organizations can take that look at their efforts across 10 different categories, across that whole continuum that Kathy was talking about, and allows them to assess, where are we? What are we doing, and how can we take steps to improve those efforts and use, based on the measurement that we're taking there, to support our workers better and to get better outcomes for them and for our organizations.
Okay, and so we're looking at a slide right now. The index applies to 3 Ps. These 3 Ps, according to One Mind at Work, are protection, promotion, and provision of care. And some of the categories that you're measuring in this index is communication, leadership, training specific to mental health, workforce involvement and engagement. I'm just going to read them all in case those who are on might not be able to see. Work design and environment, measuring, monitoring, and reporting, organizational culture and impact, related employment practices, and mental health strategy. So basically what you're saying is this mess, this stressful situation that people are trying to figure out how to improve our mental health at work, there's actually different categories that you can drill down into to figure out, where are we strong? Where are we weak? Where can we improve? Okay.
Yeah, and the index allows people to get a baseline measurement of where they are, and it's based on a maturity approach. So it meets you where you are. It's not saying you have to be perfect or doing everything right now, but wherever you happen to fall on that continuum, it helps you identify where can you make data-driven decisions that are going to take you to that next step to help you improve a little bit and keep moving forward and improving your efforts over time.
Yeah, it's so interesting because, you know, I've been in newsrooms for 20 years. I recently left one, and I noticed that newsrooms are a place of high burnout, high stress. And as people started to care or be more aware of mental health at work, we started to have more free food at work. And we got Keurig cups and, you know, free coffee. And there's a little hit of excitement, but ultimately, if you don't have job clarity, or your role is ambiguous, you're still feeling pretty ticked off while you're eating that free taco, right?
Mhm.
I want to bring up a statistic here. 65% of organizations do not have a process for identifying psychosocial hazards that may pose risks to worker mental health. So, while organizations are amping up free food, and they really want to help their folks who are in the trenches, 65% of them don't know how to identify the psychosocial hazard that actually may be wearing us down. So, Kathy, what is a psychosocial hazard?
So I'm laughing about your Keurig cup story, Kate, because the good news is that it's hard to find a leader today who doesn't appreciate that mental health matters. The opportunity is to help people expand how they think about how they can have impact. Because as David was saying earlier, and we've touched on this, historically, the strategy has been focused on providing some additional benefit or perk to an individual that in some way will help them feel better and cope better in the environment in which they're working. And the Mental Health at Work Index recognizes that as an important piece, but only one piece of a comprehensive approach that looks upstream and looks systemically and structurally at how we do the work of work. And that's where this story about psychosocial hazards comes in, because psychosocial hazards are factors in the workplace, in the work environment, that can cause stress, strain, interpersonal problems, and all of that over time can have a negative impact on people's mental health and well-being. And that then translates into the outcomes that you were describing of being, ticked off, all the way to being stressed and burned out and showing up but not really being able to work, to then not showing up at all, right? So learning the index is a tool that enables decision makers within the workplace to actually carefully look at how are we showing up for our employees and our workers. How are we structuring our programs, policies, practices in the workplace across those categories that you described? They could be categories that are organizational. How are jobs described? How are what's workload? How is workload managed? How are reporting lines? People who have conflicting reporting lines, that increases stress. Poor management systems in terms of project planning, program planning, change management. So all of those factors around how work is managed, how work is designed, interpersonal factors in the workplace can have a significant impact on people's mental health and well-being. Are there policies and practices in place, and is there a culture that effectively addresses the violence or bullying that can take place in the workplace? What are the rules and policies around how we interact with each other? You opened up talking about an environment of polarization in which we live. Things are only going to intensify as we move towards election day, as we have these other macro events going on in the world. What are the policies and practices around civility in the workplace? These are things that have huge impact on people's overall mental health and well-being, that present hazards, risks for in a workplace for workers. The way the index gets at this is, as David described, it's a maturity scale. So if you are below a minimum standard that has been set based on the data and best practice consensus, you get a red flag. And it's the first step in looking at your program's policies and practices to say, where might we be performing below an acceptable level in such a way that we are actually increasing risk and actually underperforming, so that if there were an adverse event, we would be seen as not up to par in what would be expected in terms of duty of care in a workplace.
Okay, and so I'm just going to recap a little bit. And so everybody's on the same page here. Psychosocial hazards create or worsen problems, right? Such as depression, addiction, suicide. This is not made up. The World Health Organization actually has a mental health at work guide, and it has found that long hours, ambiguous roles, harassment, lack of autonomy at work, these all are psychosocial hazards, as Kathy mentioned, that can worsen problems or create them, including depression, anxiety, and even suicide. And so this is real. And in order to fix it, what you're saying is you've got to know the state of the body. You've got to know the state of the body and the mind of your organization. And so actually taking this index is a way to begin to notice where is it that we need to improve. Ryan.
And Kate, can I just add,
Please.
One of the things that happens often in organizations, to your point, as you just put a point on it, oftentimes organizations don't pay attention to these issues until they have a very severe adverse event. So they have a suicide. You have a high-performing professional who's in a high-stress situation. And to your point, these are real psychosocial hazards that at a certain point, even your highest performing, someone who came into the organization without mental health conditions can reach a breaking point, and have you wind up in a, organizations wind up, unfortunately, in these tragic situations, not measuring in advance and not paying attention in advance to these psychosocial hazards.
Yeah, that's exactly right. I mean, we've experienced it in newsrooms that I've been in. Ryan, I want you to give us a real life example from HCA, because you actually used the index. And I don't know if you're able to answer Laura Wood's question. She's in the audience and she asked, how does an organization start to work with the index? Do we need to have specific programs already in place? Ryan, we're going to let the One Mind folks answer that. But first, Ryan, how did you start to work with the index and what did you find?
Yeah, I appreciate the question and Kathy's comments too, especially around psychosocial hazards, because as a person who is also responsible for occupational safety within the organization, this is something that we've done from a physical hazard standpoint for a long time, but have not done nearly as well on the psychosocial front. And so, like most organizations, measurement means a lot at HCA. And so the index has been invaluable for us. And we had the pleasure of being one of the founding corporate council members in the development of the tool for us to be able to measure and understand where we truly are. And as you take that assessment, a number of things have come up throughout the organization. The first was even taking the assessment, it required a different level of collaboration across the organization than we had previously. This isn't something that I did on my own. This isn't something that another team did on their own. We really had to come together cohesively to understand what we looked like. What we learned was that we did a great job in some of the categories like our benefits. It often starts there with organizations. When we think about what we want to do to create the right kind of environment and provide support for our employees, it often starts with the provision of resources. So benefits were solid. And what we did to communicate those resources being offered was also fairly strong. What we learned was that there was an opportunity in bringing together all of those different things into a single strategy. And to my earlier point, we also needed a consistent way of measuring where we are into the future so that we understand the progress that we're making. And so those stood up as opportunities for us through the index. And now as we think about moving into the future, we can understand what our maturity was when we initially took it, some of the things that we're putting in place because of that, and then measure against it to see if we're making progress, not just in those areas, but across those 10 different spectrums.
So I remember I was talking to Ryan before this, and in our conversation, you mentioned you walked in and said everybody has great intentions, but everybody was siloed. It was like a balkanized state where different groups were trying to fix it, and then a lot of it was top down, and you found you needed to create a way to communicate from bottom up. And not only that, but when you have an organization where people are mission driven, self-care can seem selfish. When you're tasked with caring for others, you had to find a way to make self-care and well-being almost an altruistic process.
And again, going back to the pandemic, it creates an environment that was ripe for that to happen. So David talked about earlier the fact that one of the benefits, if you can call it a benefit coming from a pandemic, was that organizations began to dive into this conversation more deeply. I would also say employees did the same. And so in an environment like healthcare, where it's all focused on serving others, we don't tend to think of ourselves in that same way. Well, this has helped change that. And as a company, to support these workers and understanding that that's their orientation, one of the things that we have to do to make it really resonate with them is to talk about how, by investing in our employee well-being, they're able to more efficiently care for our patients. So we have to tie it to what's really important at their core, and not just the patients, but then those around them that they love and care for as well. And by being able to make that connection, it doesn't feel selfish. It does help them continue to be that compassionate caregiver that they are every day, and they understand how self is important in being able to do that.
Yeah. David, how does this spell this out, how data actually helps us change?
Yeah, I think I'm just going to reinforce everything Ryan said, because he already covered it all brilliantly in a real world
We're
example.
done. We're done.
Thanks, Ryan. Make my job easier. So I think it comes back to starting with a good assessment and taking an approach to measure and improve. One of the things that we found in the first year of the index and the organizations who've gone through it and used it is that fewer than 4 out of 10 were assessing the effectiveness of their efforts. So people are committed, leaders are committed. Two-thirds of leaders had said this is a priority for our organization, but only 1 in 4 had a strategy for doing that. So by getting a good data to start with, finding out what your baseline is, then doing all the things that Ryan was describing, they did, get leadership on board, put together that cross-functional team so you can get that variety of perspectives, bring in and get worker input. So it's not leaders making decisions from on high. It's people co-creating these efforts that are going to be a good fit for the organization, and do that psychosocial risk assessment. So the things Kathy was describing a while ago, identify what are the things in your work environment, in your particular industry, for the people in different roles and functions in your organization that they're exposed to every day. And don't just give them tools to cope better or be stronger or be more resilient. Eliminate those hazards, reduce the risks, do the things to change the way we're working, change the culture of the organization and the actual environment to buffer them in the first place and to provide resources so they can actually thrive and be on the other end of that continuum. So without all of that, people are just throwing things against the wall and seeing what sticks. They don't know whether efforts are successful or not. They don't know what of 100 different possibilities to pursue that might make a difference. And by getting these metrics and knowing where are the big gaps, where are those red flag scores, where can we make the most improvement, allows them to pick not 100 things, but a few things, a handful of things that are going to have the biggest impact on their workers and on the performance of their organization. And the last thing I'll say about that is, we think it's really important for organizations to tie these efforts to performance within the organization. So things like turnover and absenteeism and work engagement and all of the things that are going to affect workers, but also affect the performance of the company. Because as you're evolving and improving your efforts, to be able to track how that's relating to the performance of workers and their well-being, help you make the business case more strongly, and will help you make smart decisions about where to invest your resources.
I think what's really interesting about this, because I look at, trends and different initiatives that are happening, and I also always look at the data. What is the data? And this is still kind of a nascent stage for mental health at work. And so I think what's interesting about what you're doing is that One Mind at Work is working with more than 100 organizations around the world. And so the more folks that fill out the index, the more information you have kind of about the state of affairs and what's working and what's not working. And so it's not just like a running coach for your org, it's actually a way of adding to the collective body of knowledge about how we can move the needle. So just like, yeah, Kathy, I hear you. But
I was just going to say, I love the way you frame that, Kate, because really, it sort of to Ryan's point about framing the work of self-care as something that is aligned with the mission of healthcare providers, and it makes it not seem selfish, but actually aligned and with their work. Completing the index is great for an organization, but it also will build a knowledge base so we can all get smarter.
yeah.
And will be good for everyone as a global community. So it really does have many, many benefits at multiple levels.
Yeah, and so the one thing I'm thinking about are the barriers to filling this out is fear of finding out that you suck. Sorry. Fear of finding out that you're not doing well.
Yeah.
Is that going to go public?
Right. So, I'm glad you raised that because organizations do have those concerns, and they say, well, what are we going to do if we find out that we're not good at something, both internally and publicly? And we know that within all kinds of, systems, ignorance is not a great defense.
Mhm.
And it doesn't save you anything, because the point that is really important to underscore is that the costs to an organization of not attending to mental health
Mhm.
there. So either you can pay unknowingly and not address mental health, or you can be intentional about how you're going to expend your resources for greater good, for your own organization, for your people, and larger. Yogi Berra said, if you don't know where you're going, you'll wind up someplace else. And I think if we don't measure, you don't know where you're going, you'll wind up someplace, but it's not likely to be the place you want to be. And so we can, you'll use these data. These data are for you as a business leader. They are your data. We are a nonprofit organization on a mission to support organizations to create healthier workplaces. We are not selling those data. Those data do not go out anywhere. They are on a platform that was built by Ethisphere that meets the standards of the highest level of regulation for organizations like Microsoft and other tech companies, that we can assure organizations these are their data and they're to serve them in advancing their work.
I think
And
that's
Kate, I'll add to that quickly, just that any of the data that we were reporting out from the index is just aggregate data. It's a summary, it's de-identified. And if you hear case examples like Ryan talking about HCA and their experience with it, those are because organizations chose to voluntarily share their stories and be part of lifting that sea and raising all of the ships in that. So we're not disclosing or sharing any of the protected information. That's up to you. And to Kathy's point, these are your data as a business leader and as an organization to use to improve your efforts.
okay. That's helpful. We have about 5 more minutes, so folks do have questions, pop them in there. And we also have the index to engage with it. You can, there's a link in the chat, and it's mentalhealthindex.org. We started with naming the elephant in the room, and I want to kind of go back to the elephant in the room. All of the organizations that are, represented here, One Mind, Kathy, is also at Columbia University, where there are protests. HCA Healthcare also has, kind of constant battles with the court system about what is HCA doing to give access to care or not. So this all creates stress for the workers, and it all creates potential for moral distress or moral injury. And ultimately, mental health at work is about relationships. And so before I got onto this call with you guys watching, I said to Kathy, great, this index is really compelling, but what happens if you have a toxic boss? Or what happens if you aren't able to communicate with a colleague? What difference does the index make? And so I want to turn that back to Kathy to help us understand, how do we take this really kind of intractable big stuff and bring it down to something that's in our power?
So it is absolutely the case. I believe very strongly that each of us and each of you listening can be leaders in this initiative, and using good data to take forward to the right people in your organization will typically be heard. If you're not feeling like you're getting the results you want to get, gathering a collective that can add and amplify voice and experience to this will move the conversation forward. And I think it's really important to understand that these efforts need to real change within an organization is a collaborative process. So bringing in, to your point about relationships, continuing to build voice and consensus and a movement almost within your organization, which is largely what, for example, employee resource groups focused on mental health are able to do, or gather an understanding of what is happening in our workplace, what are the real pain points, and how can we collectively and effectively be heard. That's where change is coming, and we're seeing it happening. We're seeing organizations respond, because the truth of the matter is, everyone, effective leaders, enlightened leaders today understand that people are the greatest resource, and mental health is at the core of a flourishing organization. And just strategically, if you want to have a high-performing organization, you want to pay attention to recruitment, retention, reputation, you have to pay attention to the mental health and well-being of your people.
Ryan, when we talked, you gave such a beautiful philosophical answer about the change that's possible in the job that you're in. Can you share your philosophy with us?
You set a pretty high bar there for that one. Here's what I'll say. I think that, and some of this has come up in the conversation. So I think there are pieces of work that and resources that can be provided by an organization to help, and certainly the index helps with that. But I think we also talked a bit around what culture means to organizations. And I think that's where the real magic happens, is within the culture of organization. And what we find is, as we invest in an initiative like this at the very top level of the organization, it makes sense and everyone is bought in and we're all about it. Where the potential to fall away happens is deeper in the organization, as you have managers and leaders who are just trying to get the work done day to day. And so to the extent that we can help make it easy for them to be able to champion this work in the same way that those who have got the strategic voice of the company can do, then I think it starts to infuse itself deeper into the organization. And if I can just, within that, kind of give an example of where our efforts are focused this year related to that, it's broadly in two spaces that are tied to having our strategy. The first is how we can prepare leaders to that point to be able to support their teams in a new way. This is not something that leaders were necessarily called to do and be very good at previously, and now we've got to help prepare them to be able to support the mental health of their colleagues in the workplace. And then the second, to your point about relationships, is how we can empower peers to be able to support each other. And by doing those two things, I think we can help shift that culture in a direction that's more supportive for everyone. I know we're short on time, so I'll leave it at that. But hopefully that meets the bar of this beautiful philosophy that you just set me up for.
It meets the bar individually and organizationally. And the other thing that I was actually moved by was, you said, you have come into a position at a massive healthcare company. And so the culture shift that is happening there has the potential to shift the culture throughout the healthcare industry. and throughout the care systems that people are interacting with. And so these tiny drops that we're doing individually, collectively, have a ripple effect. And that's what kind of gave me goosebumps, is like, if we're committed to this, there is actual potential for positive change, that imagination can become reality. So Joe Grasso asked if we have data and slides to share on impact and burnout. We're going to get that for you and we'll email it to you. And there's also, Paul Griggs is asking, does your index address ways to make organizational and individual change? Once we get the results, are there resources to help make change? And I would say, I'm going to speak for One Mind because I did a lot of research on them. Yes. And I think if you fill out that index, they will get you more information, or go to that link, they'll get you more information. We are out of time. This is the beginning of a conversation that we are having with ourselves, with each other, and with the people around us. So Kathy, Ryan, and David, thank you so much for being together. And to everybody watching, thank you for the energy and care for yourself and your organization that you chose to spend time with us.
Thank you.